How can we prevent uterine fibroids and halt their growth? In medicine, often the best treatment is prevention. In the previous episodes of Fibroid Fridays, we talked about how disruptive fibroids can be. And so in this episode, let's talk about how we can maybe prevent uterine fibroid growth or potentially halt the growth. This is Fibroid Fridays, where we're looking to bring fibroid awareness to the online community. My name is Eric Schmidt. I'm a board-certified OBGYN, and let's recap what we learned in the previous episodes. Fibroids are non-cancerous growths of the uterus muscle. They are common, found in approximately 70 to 80% of reproductive age females. However, luckily, only about 25% of those are symptomatic with their fibroids. We identify fibroids mainly on ultrasound. However, sometimes we might use MRI, or we might incidentally find fibroids on a CT scan. Location of the fibroids matter. This matters for potential symptoms, and this also matters for potential treatment options. We also discussed a lot of the risk factors in the previous episodes that someone might have for uterine fibroids. Okay, everyone, we're getting really close. We're about to talk about the different treatment options that someone has for their fibroids in the next few episodes. But for this episode, what I want to concentrate on is different prevention options and hopefully decrease your risk of developing larger or more symptomatic uterine fibroids. And these can be with simple, low-risk remedies. One of the most modifiable things that we can do to decrease our chance of uterine fibroids is to change our diet. And this would be to increase things such as fruits, vegetables. This would be leafy greens. This would be the cruciferous vegetables. This would be broccolis, cabbage, etc. Also increase things like whole grains and flaxseed in our diet. And we really want to reduce a few things, including red meats, simple sugars, alcohol that might increase our chance of fibroids in the future. Another key point that we can modify is our stress. Stress does manifest itself physically, and it can increase someone's chances of developing fibroids. And so we really want to be taking care of not only our mental health, but our physical health, because both of these things can reduce our chances of developing uterine fibroids. Now, there's some really good and exciting data coming out that a few simple over-the-counter options may reduce your chance of uterine fibroids. This would be things like green tea extract and vitamin D in combination with vitamin B6 has shown to decrease uterine fibroids in a number of studies. So green tea is one of the most commonly consumed beverages throughout the entire world. And if I were to guess, actually the lowest consumption rates are in places like the United States, where we have an increase of inflammatory type disorders that are manifesting themselves and making us sicker. The active part of the green tea is the OBGYN, and this is a capsaicin that is going to help decrease inflammation and be an antioxidant that hopefully this is what all goes into decreasing uterine fibroid growth, but it can also be good for other benign disorders of the female reproductive tract, such as endometriosis, PCOS, and potentially even a good treatment for menopause type symptoms such as hot flashes. So we discussed vitamin D a lot in the prenatal vitamin episode, and what vitamin D is, it's mainly synthesized through sun exposure. We don't get a lot of vitamin D through our diet, and that's why sometimes we need to supplement it. Vitamin D helps a lot in maintaining good bone health and bone growth in both kids and adults. But the other roles that vitamin D has is anti-inflammatory, and this is where the big role comes into hopefully decreasing the growth of fibroids. Is a lot of that is thought to be a pro-inflammatory type disease, and so taking things in that might decrease inflammation might help to decrease our chance of uterine fibroids. This can be taken in also combination with vitamin B6, which is pyridoxine. Again, useful in pregnancy, decreases someone's nausea maybe, but this vitamin B also helps in combination in some studies to decrease fibroid growth. The nice thing about all of these supplements is that they're very safe. And supplementing it in a recommended amount by your doctor could be a very low risk, very low side effect option that someone can do and potentially reduce their fibroids, because in some studies where they combined the OBGYN, vitamin D, and vitamin B6, they saw potentially up to a decrease in uterine fibroid size by 40%. 40%, that's a lot. And so this was over a 4-month period in one study, over 90 days in another study. The range in supplement was for the OBGYN range from 300 to 150 milligrams a day. And for those 90 days or 4 months, depending which study you look at. And vitamin D ranged from 50 to 25 micrograms a day. We'll put up here the daily recommended amounts of vitamin D supplementation, but vitamin D was used in approximately 50 to 25 micrograms daily, and the vitamin B 10 to 5 milligrams daily. Again, talk to your doctor in regards to these options and getting the right dose for you. All right, everyone, that was hopefully a good, quick overview of what we can maybe do to prevent uterine fibroids. And what the nice, promising thing is that these are low intervention things that might decrease fibroid growth. And so please give us a like, subscribe, follow along. We're going into the treatment options next, so stay tuned on Fibroid Fridays. Have a good day. The active part of the green tea is the EGCG.